So if you're not feeling well, then you need to look for a wellness provider or a hormone specialist. And I have seen there are so many med spas popping up on every corner right now. And, they go to what they call pellet training, and they have one class and they call themselves a hormone specialist. And what they're doing is they're just plugging numbers to the program and dosing patients according to what it says, but they're not actually listening to the patient. They don't know the patient's history, and they haven't been doing this long enough to know how to avoid side effects. And then people are getting, they're having issues. And so hormones are getting another bad reputation there, because of the side effects. So definitely look at their years of experience. How long have they been doing this? What is their specialty?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Heather Smith, a board-certified women's health nurse practitioner and certified hormone specialist and aesthetic provider who founded Rejuve Wellness and Aesthetics in 2015 in the Woodlands, Texas. She then expanded to Montgomery, Texas in 2023, and then added a salon location in 2025. She graduated from the University of Texas with her master's in nursing in 2012. Making people feel happier, healthier, and more confident on the inside and outside is what drives her, and she has a passion for serving others. Her and her husband are both former national level fitness competitors, so health and wellness has always been a huge part of their lives. So Heather, welcome and glad to have you here on the show.
Hi, thank you for having me.
Yeah, so let's start with this. How did you first get interested in the medical field?
So from a small age, I knew that I wanted to be a nurse. I really like helping people. And then as I had my first child very young, and my experiences with having my babies in the hospital were always great. The nurses were excellent. As I got a little bit older, I had some infertility issues. And so I actually began working in the infertility field after going through that, which led me to be interested in hormones and hormone replacement. So when I graduated nurse practitioner school, that's what I decided to specialize in.
Okay. And then what caused you to want to open up your own practice?
So I have always been super driven and just really ambitious and a go-getter. I can't sit still. I'm always adding something to my plate. My husband laughs all the time because he's like, we have 7 kids, we have all these businesses. Can you just stop adding things to our plate? But I'm just always, ready to get something done. And I had started off working for another doctor, and I just didn't agree necessarily with some of the things that they were doing at that practice. And then I moved to another practice. And again, I didn't have the autonomy that I had hoped for. And in the interim, my husband, he's a personal trainer. We had our own gym. And so we knew that all of those clients could benefit from hormone replacement. So we decided to merge together and start a wellness and fitness place. And so that's kind of the birthing of Rejuve.
Got it. Okay. Now, I know that you have a strong background in hormones. You talked a lot about hormones. I really want to dive into that a little bit more, but I think it's interesting since your practice, I guess it's categorized as a medical spa, but there's more of this wellness component to it, where I think most people in the past, you think about medical spa, okay, it's about Botox, it's about fillers, and that's really all it is, like maybe some laser treatments. But it seems like the hormones and the wellness is a little bit newer, as far as I'm seeing more and more med spas bring that in. It sounds like you kind of already started with that from the beginning.
Yes, I did. I kind of did the reverse of what most people do. And I started with wellness and health because we had, the gym. And so I do a lot of hormone optimization and gut health, functional medicine, and then thyroid management and weight loss. And then in 2019, I brought on medical aesthetics into the practice. And so I'm able to treat the patient from within and on the outside, kind of the whole person.
Yeah. Okay. So with what you just mentioned, hormones, functional medicine, gut health, for all this, if you had to explain it to a 5th grader, what the benefit, I guess, what is all like the hormone replacement, functional medicine, like what is it and how does it really help people? What's the benefits of it?
Okay, so we are looking to really prevent illness before it happens. So we're looking at achieving, healthy diet, making sure you're doing some sort of exercise to stay active. Make sure you're treating any vitamin deficiencies before they happen. Just making sure that overall, you're living optimally so that we can prevent disease long term. We want to decrease high blood pressure, we want to decrease high cholesterol, decrease obesity, so that we're not going back like Western medicine and just treating symptoms and throwing medication at you.
Okay, so then with the hormone therapy, I want to go into that one a little bit more. So with hormones, I think people know at least kind of what hormones are, but I think they have a very service level understanding of it. Like with men, it's testosterone. Okay, it's just testosterone. With women, it's just estrogen. Is it really as simple as that, or is it like how much more nuanced is it than that?
So I think that hormones have gotten a bad rep over the years. Actually, a lot of people are scared. They hear hormones and they think cancer automatically. But basically, we all have hormones inside of us, men and women, and we need different levels of each one to make us function properly. As we age, those hormones start to decline naturally. Things like environmental factors, your diet, how much you exercise, genetics, all the things play a role in how fast these things decline. So when I talk hormone optimization, I'm really trying to do is get your levels back to what they were when you were in your 20s.
Mm,
So
okay. And so, you mentioned before people had this fear as far as hormones cause cancer. From my
yes,
understanding is that there was a study done some time ago that found a correlation between hormones and cancer, but it seemed like it was a very flawed study. They were also using, I think, synthetic or like it
yes.
was like synthetic hormones and like massive amounts that like no one would ever realistically use or something along those lines. Is that correct?
Yes, that's correct. And what I do at my practice is I only use bioidentical for the most part.
Mm-hmm.
I do use some synthetic testosterone at times if we're going to use injectables, but I closely monitor your labs. I also don't just go based on your labs either. I listen to the patient, the complaints that they're having, the symptoms, and I correlate that with the labs and the knowledge that I have over the past 14 years of doing this and put together a plan using plant-based or bioidentical hormones. And what those are is they're identical to the structure of the hormone that you already have in your body.
Mm-hmm.
And so they're natural. And they've actually done studies that have shown prevention of things like breast cancer long term.
Okay. So the bioidentical compared to the bioidentical is more geared towards natural, where the synthetic is fake,
Man,
man-made.
yes,
Okay.
yes,
Okay.
yeah.
Got it. So when it comes down to you're mentioning the levels, are there certain levels that you should try and aim for? Is it going to be really dependent on individual by individual?
So typically, yeah, there are optimal levels that I like to look for. So a lot of times when you go to your primary care physician, take an example, they look at your thyroid and they're like, oh, it's normal because they're looking at the little lab levels on the paper, which those can vary from lab to lab. But what I try to look at is let's get you in the optimal range. So the higher end of normal, because we want to be functioning at our best, not just mediocre.
Okay. So you really want to be closer to that optimal or higher end of the range.
Correct. Yes. And
Okay.
then, for example, like for testosterone,
Mhm.
a lot of women don't realize that's super important for them, just as it is for men. And it's not just for sex drive. It's long-term prevention as well. It prevents osteoporosis, Alzheimer's, and heart disease.
Okay. So with men, when they come in, is it really just you're trying to figure out their testosterone levels? And then with women, it's testosterone, it's estrogen, and I think there was one more progesterone.
Progesterone. And then I look at thyroid for both individuals as well.
Mm.
And we also look at cortisol levels. I'll check iron, vitamins, complete blood counts. I try to look at the whole picture.
Okay. So when someone comes in and they're looking for a treatment, it could be, I'm assuming it's going to be very, very customized, not just the potential hormone side, but also nutrition, supplementation. I don't know if you go into like hydration and sleep and things like that. Would that also be included?
Correct. Yes, sir.
Okay. So in what situation then would someone want to come in and look for this type of treatment? Like, what symptoms would they be experiencing where they just feel something's off?
So the top complaints that I hear are going to be low energy, brain fog, mood swings, weight gain is a big one. For women, irregular periods or lack of periods, hot flashes, things like that.
Mm,
Sleep is a big one too.
okay. And so when it comes to all these different treatments, then um, you're basically trying to get them to feel like, oh, it gets back to normal.
Yes, or better than they do. A lot of people don't realize because they've been so deficient for so long,
Mhm.
they don't realize how they can feel or how they used to feel. They've just gotten used to feeling that way.
Yeah.
So it's life changing for sure.
Mm. Okay. So then I guess could the argument be made that everyone should at least take a look and see if this can help them, like at least just look into it.
Yes, 100%. I recommend it for everybody because we want to try to prevent and not get to the disease and then have to treat and backtrack.
Okay. And where does it all start? I mentioned as far as like getting started, but like, what does that look like? Is it really just as simple as getting a blood test and labs done, or is there more that goes into it than that?
So we'll start with labs and we'll have the patient come in. We do blood work in-house. It takes about 48 hours for the results to come back. And then they'll come in and meet with a provider like myself, nurse practitioner, to go over the labs and have a complete consult about their current symptoms, medical history, medications that they're on, diet, all the things. And then from there, I'll develop a treatment plan and we'll get started. And then after about 6 weeks of being on the program, I'll have them come back and we'll recheck their labs again, go over how their symptoms have been relieved, if there's anything else we need to work on, those kind of things.
Okay. And when it comes to the gut health, I want to talk about gut health because that's something I think not a lot of people understand or really what goes into it. So,
Right.
what is gut health? If you can just give a quick, simple overview of what it is.
Yes. So the American diet is not great. And the foods that we eat have caused a lot of what they call dysbiosis in the gut. So dysfunction. There's overgrowth of bad bacteria. There's not enough good bacteria. We introduce bacteria that cause things like H. pylori, just diseases that people aren't aware of. And then you might experience symptoms like bloating, diarrhea, constipation, GERD, like acid reflux. And then you'll either get an acid pill from the primary care or they'll send you to GI and then they're running all kinds of tests and usually come out with they don't have anything. Most of the time they don't find anything. And typically what I like to do in those cases is what we call a GI map. It's a stool test and it's going to be a really detailed test of if there's any viruses, overgrowth of bacteria, like I mentioned. It tests, how is the inflammation of your gut, things like that. And then it will help guide us on what natural supplements we can use to get the gut corrected, whether it be probiotics or, another type of vitamin, whatever kind of deficiencies we need to treat.
Mm. Now, you mentioned that when people get this checked out, the tests often come back with nothing or they can't figure it out. Why is that the case? I mean, is it just like that their tests are not looking for the real culprits, or like is it misdiagnosed? Like what's the biggest reason?
So the tests that they're doing at the GI doctor are more physiologic tests. So they're looking for polyps or physical things that would be off, and they're not testing what they actually should be, which is for the bacterial things, viruses, parasites, those kind of things.
Okay. And then when it comes to tips to improving gut health, I mean, just for the layperson, is it just lay off the fast food and the soda, or is there a lot more that goes into than that?
There is it definitely watching what you eat. I mean, it's really hard, like I said, in this country to properly get the foods that you need that aren't going to cause these issues. But yeah, just watching what you eat, keeping it organic if you can, watching the chemicals that you put into your body. Stress is really big. Actually, our brain is tied to our gut. So stress can cause issues with the gut, and that can throw everything off. So there's so many different factors, fragrances, plastics, all the things. you think about heating your food up in a plastic container, which a lot of people do when we have leftovers, and all of that is getting into the food and then you're digesting it. So it's also causing disruption, improper release of toxins, all kinds of things that you wouldn't think of.
Wow. Okay. Now, for the symptoms, you mentioned some of the symptoms,
Yes.
but if you're having troubles with gut health, are there other symptoms that you wouldn't associate with the stomach? Like you mentioned, like acid reflux or diarrhea or constipation. But if you have issues with gut health, could you experience something completely different, like migraines or like back pain or things like that?
Yes, 100%. Brain fog, mood swings, depression, anxiety. And a lot of people don't know that all that can be tied together, and that, they're going from doctor to doctor to get answers on why they have all these issues, or they're getting thrown on an antidepressant. Or, for example, my husband, he was having issues with fatigue and brain fog. And we had been to every doctor, including a neurologist, and nobody could find anything. And his was related to gut. So,
Hmm. Interesting. Now, I've also heard that it's not just the bad food. There's even potentially some good food that for some people it's really, really good, but for others it causes a lot of gut health. So is that true?
so you have to just watch overeating the same food over and over again. We run like what they call food sensitivity testing, but a lot of times those can be skewed. Like, for instance, if you eat eggs every day, well, that's going to probably come up as a food sensitivity, but it's just because you've been overeating it. But you can definitely cause yourself a disservice if you don't offer a variety of foods and you're sticking to, the same thing repeatedly.
Okay. Well, and when you say variety, what's a good benchmark for people to kind of keep in mind? Is it like a certain number? Is it like certain types of food, like proteins or carbs or plants or fruits? Or how would you kind of give the average person just some guardrails to try and keep in mind for variety?
Yeah, so I believe that you need all food groups. You shouldn't be cutting out carbs completely, or yeah, I think higher protein, but as far as amount of protein, I think over the years, there's been a lot of discussion about whatever your body weight is, that's what you should eat in grams of protein. That tends to be a lot for women as we get older, and I see that they have a hard time losing weight. So I think, a good percentage of protein, fats, carbs. I think all food groups should be included, and it's really going to be based on, your body type, eating for your body type, and your genetics, really.
And when you say eating for your genetics, could you clarify that?
So, for instance, I am insulin resistant. So, I have tried in the past completely cutting out carbs, and I did my body a disservice because
Mhm.
it'll work for a temporary fix, but
Mhm.
after a while, your body gets smart and it starts holding on to weight. So,
Mhm.
I have just found that, eating a little bit less carbs or putting my carbs around when I'm most active, whether that be like pre workout, post workout, those kind of things, and eating the right carbs. So, not French fries or, but sweet potatoes, brown rice, those kind of things.
Uh,
Women who have insulin resistance, or like who've had a lot of children, or if you're menopausal, things like that, are going to need a little lower carb diet.
okay. So really what it is, it's coming up with your own customized plan on how your body works.
Yes, which
Okay.
goes back to getting the labs done,
Mm.
because that also helps us. If you have a man who is gaining weight in the midsection, typically that is low T or low testosterone causing that issue. And once we get them back where they need to be, they usually drop weight pretty quickly, and get back into normal range. And I've also seen cholesterol levels fall too.
Okay. Now, with all these different treatments, I think a lot of people don't necessarily know that like what's involved in it. I'm sure you get a lot of misconceptions, a lot of people coming up with
Yes.
myths. I think the biggest myth is probably the cancer one. I've heard that one quite a bit. But what are some other common misconceptions or myths you hear about these types of treatments, the gut health, hormones, functional medicine, any of these types of treatments?
So a lot of people still believe in that they're more in that Western medicine thought of I only need to go to the doctor if I'm sick, or I don't need to check my labs because I'm healthy.
Mm.
But that is a huge misconception because, why do you want to wait until you develop a disease and then go get treated? Why don't you prevent and not get the disease? So that doesn't make sense to me. I also feel like, like we talked about, the cancer thing is huge. One big thing, like with thyroid, for instance, is patients are scared that they're going to have to stay on it for the rest of their lives.
Mm.
And like thyroid, for example, is one of those things. If you have a suboptimal thyroid or you don't necessarily have like a thyroid condition, we can change that with a little bit of thyroid optimization, diet, exercise, stress management, and we can better those lab results. And you don't have to be on a thyroid medication forever. So I
Mm.
think that's also a common myth. And then the use of the GLP-1 medications now, which is really big. I use them a lot in my practice. And one thing that I always tell the patient is you don't need this forever. We can wean you off once we reach your goal weight. And as long as you're managing your diet and exercise, you should be able to maintain this weight loss.
Okay, so some really good myth busting right there then.
Yes.
So when it comes to the labs then, because you mentioned that the preventative part, like not waiting until you're sick, how often should people be getting their blood work, their labs done? Like, should they be doing like every year, every other? Like, what's a
Yes.
good cadence to keep an eye on it?
I definitely recommend annual labs for sure. My patients do that a little more frequently just because I have them on hormone replacement and I want to make sure that the levels are stable. So every 6 months is typically what we recommend, unless we're making changes to their plan, then it might be a little bit more frequent.
Mm.
If you're not on any hormone therapy, then annual should be sufficient.
Okay. Now, Heather, when it comes to, let's say the consumer, an individual is looking for a provider who can help them with this, what would be your most important piece of advice you would give them as they're trying to find some? Because we kind of talked about almost sounds like you're the last stop for people. Like they've gone to their doctor, they've gone to a GI doctor, they've gone to whatever doctor, and like they can't find any issues. So it almost sounds like you're the last stop when you probably should be the first stop. So, what
Yes.
type of advice would you give to someone who's looking for that good provider that's able to help them, guide them, no matter what issue they're running into?
So I tell them to look at their specialty. So if you want somebody that, is treats just GI, you go to a gastro doctor. If you want to have a facelift, you go to a plastic surgeon. So if you're not feeling well, then you need to look for a wellness provider or a hormone specialist. And I have seen there are so many med spas popping up on every corner right now. And, they go to what they call pellet training and they have one class and they call themselves a hormone specialist. And what they're doing is they're just plugging numbers into the program and dosing patients according to what it says, but they're not actually listening to the patient. They don't know the patient's history and they haven't been doing this long enough to know how to avoid side effects. And then people are getting, they're having issues. And so hormones are getting another bad reputation there because of the side effects. So definitely look at their years of experience. How long have they been doing this? What is their specialty? And go from there.
Okay. Now, you brought up this good point I'm curious about. As far as when you're doing the hormone treatment, there's different modalities to get the hormones into your body. And I'm curious, you
Yeah.
mentioned pellets, basically putting a pellet under your skin and having it, I guess, dissolve over time. What's your thoughts on pellets?
So I've been doing pellets since I graduated nurse practitioner school in 2012. I really do like them, but like I said, it takes somebody who's been doing this at least a decade and really listening to their patients to know how to manipulate pellets. Because if you use the dosing system and you go based on just what they're telling you the dose should be, that doesn't always play out.
Mm.
So, with my women, especially, a lot of the times they're overweight or they want to lose weight. Well, if you're just pelleting testosterone at that dose every 3 to 4 months, and you're not really listening to the patient or manipulating the dose based on experience and things like that, then you're going to run into a problem. But I think it's great for a lot of people. It's a consistent dose over 3 to 4 months for women, over 6 months for men. It's bioidentical. It's a safer method. They don't have to remember to do anything. But there are patients where pellets are not suitable. And that's why there are other forms of replacement as well.
Okay. Now, Heather, what role do you believe creativity plays in how you approach your patient care?
So it has to be unique to the individual. So I really listen to my patients. I give them an opportunity to have some autonomy in their care. I want them to feel heard, and I make sure that, the plan is unique to the individual. So everybody can't be on the same method of hormone replacement because everybody's body is completely different.
Okay. And I'm also throughout your career and having the practice, I'm sure you've experienced some tough cases, challenging cases, or just memorable cases. Is there maybe one story that comes to mind that you can share, just a memorable or challenging or tough case that came in and how you were able to get them a great outcome in the end?
Yes, I have helped a number of individuals actually get pregnant, which is really, really rewarding. I was adopted and I was an only child. And then I had a big, huge family, but I did have some infertility struggles in there. So, being able to conceive after getting your hormones corrected and everything balanced is huge to me. And just being able to get help in those women's journey was amazing.
Oh, wow. Okay. I didn't realize hormone treatment can actually help with fertility.
Yes, yes, yes.
Interesting.
So there's a number of women who have PCOS,
Mm.
and so they're not having regular periods. Their estrogen progesterone balance is off, and so they're not able to conceive. And so I've had a number of those patients who have been able to correct the deficiencies and imbalances, and then they went on to conceive. So
Wow. Okay. That is a very memorable, very
yes,
interesting case.
yes.
Okay. Now, Heather, where do you think the future of wellness is going?
I think it's about to boom, actually. I think a lot of more people are waking up and wanting to take control of their health. And so I think that it's going to be crazy over the next 10 years, the things that are going to come out. And I think more and more people are going to live longer.
With a higher quality of life also?
Definitely, yes.
Okay. Yeah, because I am seeing a lot more practices bringing in functional medicine, hormones, wellness. Like even 2 or 3 years ago, when I spoke to a med spa, most of them were just doing the aesthetic side. But it seems
Correct.
like more and more and more starting to bring this wellness side, which I think is great. I mean, I think it's good that people are starting to take more responsibility for their health, and it seems
Yes.
like they're not relying, or maybe they're just so fed up that it's like, why are we sicker? Why are we living shorter now? It's like I'm still going to the doctor, but like, how come things are going in the wrong direction? So it seems like people are taking more of that education into their
Yes.
hands and trying to find
Definitely
out
a shift.
what's like, how am I responsible for my own health?
Yes. Yeah.
So,
There's
okay.
definitely been a shift in healthcare for sure.
Mhm. Now, for your practice, Heather, Rejuve Wellness and Aesthetics, what's your vision for your practice?
Just being able to treat the entire person. So from the inside out, making you feel more confident, beautiful, healthy, feel better overall. So that was always the goal, especially when we started with the fitness and the wellness combined, was to treat the whole person. So instead of just going in and treating one symptom and having a medication thrown at you, we were doing it from the inside out.
Okay. Now, Heather, I have one last question for you, but before I ask it, I want to point people to your website at rejuvemedspa.tx.com.
Yes, sir.
Now, last question is, what does beauty mean to you?
So, beauty to me is just feeling confident inside with how you look and feel. You don't have to, have a certain hairstyle or, have big lips or, whatever it is, the nicest dress, as long as you feel confident in the inside. I think that's beautiful. So I think that relates to everything that we do. It's not just aesthetics, but you have to feel healthy and happy mentally and physically to feel beautiful as well. So I hope that I can provide that for my patients.
Awesome. Well, there you have it. Heather sharing her expertise. So, Heather, where can people contact you in your practice?
So they can contact us at our website or we're on Instagram as well. We have a Facebook page. So any of those places.
Awesome. Well, Heather, this is awesome. Thanks for coming on. Thank you for dispelling some of these myths around functional medicine, hormone treatments, gut health, and just thank you for sharing your message.
And thank you for having me. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.